Hey everyone, welcome back to the channel. Today we're tackling a major question. What did people do before Medicare? If you've ever wondered how older Americans managed their health care in the days before 1965, this video will uncover the challenges, the ingenuity, and the struggles they faced. Before Medicare was signed into law in 1965, older Americans faced enormous hurdles in accessing and affording health care. Let's break down how they managed. First, let's talk about out-of-pocket payments. Back then, there were no widespread health insurance programs for seniors. Most people paid directly for medical care, which often meant digging into their savings or going into debt. For many retirees who no longer had a steady income, even basic healthcare services could be financially devastating. This forced some seniors to skip treatments or delay care altogether, leading to worse health outcomes. Next up, families were often the primary caregivers. It was common for elderly parents to live with their adult children, who would take on the responsibility of managing their health. Families provided at-home care for illnesses, injuries, and even chronic conditions. This wasn't always practical or sustainable. Medical knowledge was limited, and caregiving could place an emotional and financial strain on families, especially those already struggling to make ends meet. When families couldn't do it all, communities often stepped in. Churches, charitable organizations, and local benevolent societies provided some help. Free clinics and hospital charity programs were lifesavers for some seniors. However, these services were inconsistent and often came with strings attached, like mandatory participation in community events or public acknowledgement of the charity received. Some older adults found support through fraternal societies, labor unions, or other mutual aid organizations. These groups sometimes offered limited health benefits, such as access to specific doctors or hospitals. While helpful, these benefits were often inadequate for covering serious or long-term medical needs. For many, self-treatment was the only option. People relied on home remedies, over-the-counter medications, or traditional healing methods to manage their health. While some remedies were effective, others were downright dangerous, and serious conditions often went untreated. For those who had no other options, hospital charity care or the poorhouse became the last resort. Poorhouses were government-run facilities that provided basic shelter and care for the destitute. They were grim places. Overcrowded, understaffed, and stigmatized, poorhouses offered little dignity to their residents. This crisis led to the passage of Medicare. On July 30th, 1965, President Lyndon B. Johnson signed the Medicare bill into law. Former President Harry Truman, a longtime advocate for healthcare reform, was the first to enroll in the program. Medicare's creation transformed healthcare for older Americans, ensuring they had access to medical services without facing financial ruin. So, what can we learn from life before Medicare? It's a powerful reminder of how important it is to have a healthcare safety net. Before Medicare, countless seniors faced impossible choices between paying for medicine or putting food on the table. If you found this video interesting, hit that like button and subscribe.